message to Charles Rangel, who is the chairman of the House Ways and Means Committee. He was a co-sponsor of H.R. 676 last year, but has not signed on this year, which is very disappointing. And we also want to voice our objection to him taking money from the private insurance industry and the pharmaceutical companies.
All the umbrellas in London couldn't stop this rain. And all the dope in New York couldn't kill this pain.
Private health insurance must go! Think you're covered? Oh no! Private health insurance must go! Think you're covered? Oh no! Private health insurance.
On a rainy day, it's like your health care coverage. It comes down unexpectedly and you need help. And the help we want, the only help that will work, is single-payer health care for everyone living in this country.
We're here today representing the Private Health Insurance Must Go Coalition, a New York-based group of health and human rights organizations supporting a single-payer national health care system or improved Medicare for all. We are asking that Chairman Rangel put his support for improved Medicare for all in action. At a recent rally, he was quoted as saying, quote, "Single payer is the way to go, but we'll see how far we can get," end quote. If he feels strongly for his support for single payer, then he should sign on to H.R. 676, the U.S. National Health Care Act, now.
My name is Eric Sawyer, and I have been a constituent of Charles Rangel's district since 1981. The same year I started showing symptoms to HIV disease back when it was called GRID. My private health insurance is leaving my ass out in the cold, exposed and vulnerable. I have in my hands copies of receipts of 7 of my 10 AIDS drugs, for which on March 20th I paid $2,992. That's more than $40,000 a year for 7 of my 10 AIDS drugs. This is unacceptable. Charles Rangel should be supporting a single-payer healthcare system, one that would allow for the negotiation of reasonable drug prices for people living with AIDS. In 2008, Charles Rangel's contributions from health insurance companies increased to $369,840 from health insurance companies. That increase is more than a triple, 3 times what those insurance companies gave him in 2004 when he co-sponsored the bill. He has yet to sign on as a co-sponsor in 2008. Some would suggest that Congressman Rangel's co-sponsoring of bills is affected by the level of his campaign contributions. Well, I know that my representative, Charles Rangel, will show these critics to be wrong. I know that Charles Rangel is not going to let me down. I know that Charles Rangel is going to return those campaign contributions. And I know that Charles Rangel is going to do the right thing and again co-sponsor H.R. 676.
We are here today to help elevate the voices of HIV, AIDS patients throughout this country, as well as the 50 million people without health insurance. The people of this country have spoken. They are committed to supporting a single-payer healthcare system in this country. The majority of physicians have spoken. They are committed to supporting a single-payer healthcare system in this country. We are elevating their voices. They refuse to take hush money, and Congressman Rangel must also refuse to take hush money. He's taking thousands and thousands of dollars from the pharmaceutical companies. He's taking thousands and thousands of dollars from the private health insurance industry. In this era of serious fiscal meltdown and crisis of capitalism, we cannot stand to have our healthcare system bankrupt when it cannot no longer this country. Our demands are not limited to just lobbying, to just pretending to ask for our rights. We're going to compel that into existence by organizing the political power to do that. And our voice to Rangel is to tell him definitively that is what we're here to do. And that is why we're here. Support single payer. Healthcare is a human right. We are here to stay and we will win.
You hear that? All right. Great,
Rangel, either join us or get left behind, because we are placing the priorities where they should be, with people and health care, not insurance company profits. Now, a group of the people who are here are going to take a letter now up to Charles Rangel's office. Are those people here? Have they got the letter?
The letter. All right.
There we go.
Great.
Not for profit. Healthcare for people. Not for profit. Healthcare for people. Not for profit. Healthcare for people. Not for profit.
They called Charlie Rangel's office, and his office said they would send somebody down to the lobby.
They wouldn't let you in.
We waited. They wouldn't let us in. So we waited, and someone came down from the office, two people. One was Socrates Solano, a community rep, and we had a long chat. I told him who we were, what we wanted, and I had a folder with some information about this demonstration and some demands and requests of Representative Rangel. We had a long chat about what we wanted, what single payer was, about each of those demands, and he told me that Representative Rangel was in favor of H.R. 676. He'd simply not gotten around to signing on, and that he would be putting it through the Ways and Means Committee, which we thought, we said that there hadn't been much evidence of that in his public meetings and his statements, and we would like a chance to discuss that with him. We were members of his district. We wanted him to know that there was support for H.R. 676, and we would like him to be more aggressive in taking leadership for it.
Forget about it. Healthcare, not homes. Healthcare, not